Principles involved in admission procedure. So what are the principles? Or based on what all aspects we admit a patient, or what all things we need to consider while admitting a patient to the hospital. So already we have seen some of the special considerations. So similar points are also coming here also, but additional one or two points we can see. So we need to consider that patient is coming to a new strange environment. So there is a change in the routine procedures, routine activities what the patient were done already. So everything is changing. So getting into a new environment is very fearful, as well as it creates an anxiety. So think about yourself. So now you are at home attending the classes. You don't feel much fear and anxiety. But once we announce that all the students should come to the hostel and stay, there you will feel some sort of anxiety. You will have certain fears how you can adjust to the new environment or hostel environment, how the teachers over there, how the management over there, how they will look after you, and what all procedures you need to go through. So all these fears or anxiety will arise at once. So same like patient are also entering into a new environment, which is the hospital, and they have to get changed in all their routines as they were following it before. So that strangeness will increase a fear and anxiety level. So as nurses, we need to consider this, that the client will always having, or patient will be always having some sort of fear and anxiety while getting admitted to the hospital. So consider that and talk to the patient and console the patient. Okay. Then second point is entering the hospital is a threat to one's personal identity. So once they are entering to the hospital, it will change their identity. So there is a change in identity. So change in an identity all the time when they are outside the hospital, they might be known, or they might be referred with their names. Okay, they will be having some name, and with that name we will call them, and with the name they are being known to other people. But once they are entering into the hospital, they will have certain IP number, OP number, everything will be there. So sometimes we identify the patient even with their IP and OP number also. That is the number they get when they are admitted in the hospital. Sometimes we need to check the number also, patient ID number also, because there can be similar name, similar surname, or similar patients with the similar names can get admitted. So in order to avoid confusion, we will say the name, and along with we will add the number to IP number to, that is inpatient number to. So with that number we can definitely identify which is the right patient. Okay. So that there will be a change in identity. And another thing is that their all booking activities are also changing when they are getting into a hospital setup, and they are whatever activities they were doing independently for their personal matters, now they will have to depend on others, maybe on staff nurses or on any other supporting persons along with them. So that is also having a change in the identity. Then people have diversity of habits and modes of behavior. The another thing what we have to keep it in our mind is that those who are admitting in the hospital will have different type of habits, and they will have different type of behavior they will be showing. So at home, you may be 4 or 5 family members will be there. All the 4 or 5 family members, what their behavior and how their attitude and their habits are very familiar to your each individual person. So you can easily get adjusted with the family environment since you know your family members very well. But when the patients are coming from different areas, different with different cultural diversity, and they will be having different habits, and they have different type of behavior exhibition too. So we need to consider that all the persons who come will have their own habits, their own mode of behavior. So we need to consider that, and we need to provide care to the patient. Then fourth point is illness can be novel experience for the patient and brings stress on his physical and mental health. So Novel experience means a new experience for the patient. So maybe you can, if you have grandparents at your home, they might be saying that in my lifetime never I had been to hospital. This is the first time I am getting into the hospital. Sometimes some of grandparents may be commenting it like that. Since it's a new experience when they are entering into the hospital, it will develop that stress and anxiety level. It will increase their anxiety and stress in them. So they will have a physical stress as well as mental stress also. So that is the difference that we can see in the patients who are first entering into a hospital. So an unknown, unexplained stress and anxiety will be developed in such patients. Okay, so these all are the points which you need to understand, keep it in your mind while we approach a patient as well as while we give care to the patients. Okay, so these are the certain principles, and you can include the points which we discussed already in the special consideration. Both mix up and you can write. Okay, so these are the principles involved in admission procedure. So now there are certain general instructions while admitting a patient. So what are the general instructions? We can see one by one. The first one is to receive the patient and help him to adjust to the hospital environment. Similar point, you have to receive the patient with a warm welcome and we have to help them to adjust to the hospital environment. We need to help them to get adjusted with the new hospital environment. So second is to welcome and establish a positive initial relationship with the patient and relatives. So we need to give a warm welcome to the patient. We have to address ourselves and we have to welcome them. Then a positive initial relationship need to be developed. So positive initial relationship means when there is a communication comes between both the staff and the nurse and the patient, automatically there will be a positive relationship develops. Okay, that the relationship to be developed with between the patient and the nurse and their relatives, then they will follow whatever we instruct. Okay. Then to obtain the needed identifying data concerning the patient. So while we are maintaining or making a communication with the patient, we can get whatever relevant information we need from the patient that is concerned with the patient for the purpose of treatment. So whatever information is needed can be collected with this warm communication and a positive relationship which we are developing. The next point is to provide immediate care, safety and comfort. So as soon as the patient enters the ward or as soon as the patient reaches us, we need to provide, start giving immediate care. So immediate care need to be initiated. So we need to make the patient safe, we need to make the patient comfort, and then we have to start our caring. The next point is to collaborate with patient in planning and providing comprehensive care. So whatever care we do, that should be when its effect, if we want to see, there should be a cooperation from the side of the patient. So there are, we get patients at our hospital, the nurse will instruct the patient to do the things, what they should do and what type of food they need to eat, which medication they have to consume at this time, how much amount of water they need to consume, and what all exercises to be done. So all these instructions will be given by the nurse, but if the patient cooperates only, then there will be some sort of improvement that we can see in case of the patient. So in order to get that cooperation, whatever we are planning to perform on the patient should be priorly informed, and we need to ensure that the patient should obey our words and they should go in collaboration with the staff nurse who is taking care. So that thing we need to keep in mind. Then next is to observe, report signs and symptoms and general condition of the patient. So that is on a daily basis or during the shift changes, we have to go to the patient side, we have to ask them we have to assess, observe them for any changes or any signs or symptoms of any illness that is present or any change in the patient condition that should be noted and that should be entered in the patient's file, so that when the doctors come for the visit to the patient, we can inform the patient and inform the doctor and get the prompt treatment at right time. So we need to observe. So for that we need to keep on observing the patient so that we can understand any signs and symptoms or any change in the patient's behavior or how they express themselves that can be noted and informed to the doctor who is caring the patient. The next is we have to to secure safety of the patient and his belongings. So the patient may bring many costly items along with him, like patient may be wearing certain jewels, patient may be having money with him. So all these things along with the patient should be maintained safely. So that we need to inform the patient the costly items can be returned back to the home, and if he needs he can keep it with him, but that should be on personal risk. So that should be informed to the patient. If the patient is living in a room, we can give him the key, room key or cupboard keys can be provided so that the patient can keep his articles, keep his belongings safe under lock. So these are the general instructions to be given and followed while admitting a patient in a hospital.